So I hope you can hear me now. Not audible. Is it audible now? Is it audible now? Right. Sorry for the slight audio glitch. So welcome to Unacademy Future Doctors, all of you. Welcome to Unacademy Future Doctors, all of you. And in this session, we'll be talking about spinal cord. So like I was saying that this is a 30-day Superfast course where we'll be discussing the basics of neuroanatomy. And it is for all of you out there who are preparing for your first prof examinations, right? And even if you're going to give it next year, this is going to be useful for you. So we have started from the very basic. Yesterday, I had covered the portion of spinal cord related to its structure, and we had covered up till the external structure. So today we are going to do the tracts of the spinal cord, which is the most important topic in neuroanatomy. Trust me, guys, I am not overselling it when I say that it is the most important topic in neuroanatomy is the tracts. All right, because if you understand the tracts, only then you will be able to understand the sections at various levels. Only then you will be able to understand all the diagrams, and only then you will be able to understand the basic essence of neuroanatomy. So tracts is the most beautiful concept to understand when it comes to neuroanatomy. So welcome to this 30-day super fast course on neuroanatomy basics on Unacademy Future Doctors. My name is Chetanya Mittal. I am currently pursuing my MBBS from AIMS Delhi. I'm almost done with my second prof, and these are my credentials, right? So I am going to be your educator for mainly for anatomy, and also not just an educator, but also your mentor throughout your first prof. So if you have any doubts related to your first prof, if you have anything that you guys want to discuss with me, you're always free to do that. All right. So moving on, let me tell you very quickly about the Unacademy subscription program. So we have one subscription called as the Unacademy Plus subscription. So what do you get in the Unacademy Plus subscription is a full access to the Unacademy application, which includes lectures from the top educators, both live and recorded. ठीक है, उसके साथ आपको मिलेगा क्यू बैंक जिसमें आप MCQ सॉल्व कर सकते हैं, and you will be able to compete in live tests and live quizzes on the Unacademy platform. Apart from that, we also have a iconic subscription. Iconic subscription, what is the advantage? You not only get benefits of Unacademy, but you are also going to get prep ladder. ठीक है, क्या फायदा है? So Unacademy is like a live coaching. Unacademy is like a live coaching जिसमें आप रोज जाते हैं, and every day you have classes, you have live batch courses. All right. Along with that, you have the Q bank and everything. The advantage of prep ladder is that जब exam pass आते हैं and you need a concise resource where all the videos they are arranged in sequence. ठीक है? So you will use prep ladder for your last minute preparation, especially because you have video lectures of all the 19 subjects along with Q bank, which has active guidance, and you will get the printed notes, which will be very useful for quick revision, and you will not have to make your own separate notes. तो आपको printed notes मिल जाएंगे, आपको जो भी ऐड करना है आप उसमें ऐड करते रहें. ठीक है? So if you want to take a subscription, you guys can take it through the Unacademy Learner app. Very soon, we are also starting a comprehensive course on anatomy by Dr. Pradeep Pawar, who's a very famous faculty for anatomy. Okay? And you can go ahead and download the Unacademy Learner application. Select your goal as NEET PG. Select your goal as NEET PG. You can either go for Plus or you can go for Iconic. You can select the duration of the course that you want, 18 months, 24 months, 36 months. And you will enter the referral code. That is my referral code. CHETANYA10, right? And this referral code is going to get you a 10% discount. Does not matter whether you are taking a NEET PG subscription or someone in your family is taking some other subscription. You can always use this referral code and get a 10% discount. And since this is an educator referral code, it will also give you the best offers on that subscription, including free months. ठीक है? तो शुरू करें. Let's start. Okay. Great. So let's start with today's topic, that is the tracts of the spinal cord. Okay, yesterday we had covered everything that was there apart from tracts and the blood supply. Okay, blood supply of the spinal cord, I'll take it up in a separate video. Blood supply of the spinal cord, I will take it up in a separate video. For now, let's talk about the tracts of the spinal cord. Okay, so tracts से आप लोग क्या समझते हैं? What do you understand by tracts? Okay, so tracts refers to pathways. Tracts refers to pathways. ठीक है, ट्रैक्स मतलब एक रास्ते से दूसरे जगह जाने का एक तरीका. ओके, इट्स अ वे फॉर impulses to be conducted. So in your body, what is there? Please understand. In your body, you have receptors. In your body, you have receptors which are like your sense organs, right? You have receptors which are going to receive input. ठीक है? Then you have a central processing unit, that is the brain. Okay, क्या होता है in a computer? What is there? There is an input, there is a processing unit, and there is an output. So your brain is just like a central processing unit, right? And then there is of course an output, whether it is through muscle, right? It can be a muscle, or it can even be a gland, right? Or it can be anything else, right? There is always an output. There is always an output signal that goes, right? Now for this signal to go up to the brain and for the signal to go down, okay, there has to be some connection. There has to be some connection, and that connection exists in the form of a spinal cord. That connection exists in the form of a spinal cord. At every level, spinal cord, it gives out sensory and visceral, sensory and motor efferents, which are going to combine, and they're going to form spinal nerves, which will come out at every level, right? So at every level you have these spinal nerves which are going to carry these stimuli. So if they stimuli, they are going to the brain, they will be ascending. So this is a ascending tract, and if they are coming down, they are descending through the spinal cord. So it is a descending tract. So do you understand the meaning of the word tract? Ascending tract and descending tract. तो आप खुद अंदाजा लगा सकते हैं कि what is a tract, right? And based on what I've just told you, you understand that ascending tracts will carry information to the brain. So they are sensory. Descending tracts, they will bring information from the brain. So they are motor. Very simple concept, ascending and descending. So if I tell you that the descending tracts of a person have been damaged, what do you think in your mind? Okay, descending tracts have been damaged. That means that the sensation of that person is fine, but that person cannot perform some movements. Similarly, if I tell you that if the ascending tracts have been damaged, you understand, okay, the person is able to move, the person is not paralyzed, but there is loss of sensation. So ascending and descending tracts. And if I say both ascending and descending tracts are gone, let's say there's a complete transaction of the spinal cord, so both ascending and descending tracts will be cut. So there are some fibers which are going up, there are some fibers which are going down. तो जो escalator ऊपर जा रहा है वो है ascending tracts, जो escalator नीचे जा रहा है वो है descending tracts. So जो नीचे आएगा वो motor information output efferents लाएगा, and जो ऊपर जाएगा those will be sensory afferents. Is this much clear to you? Basic, very basic concept of tracts. So yesterday we had discussed about the spinal cord. Important thing, I told you that it is 45 centimeter in length. I told you some other structures also that were 45 centimeter in length. For example, the femur, the ductus deferens, right? The thoracic duct. These three other structures are also 45 centimeter. Okay. So apart from the spinal cord, we discussed the positional changes of the spinal cord. So in adult, it ends at the level of L1, L2. And where does the dura mater end? The dura mater ends at the level of S2, S3. So we perform lumbar puncture in between these two vertebral levels. So I told you about all the spinal meninges. We had also differentiated between two types of dura, that is spinal dura and cranial dura. So we had done this differentiation of spinal dura and cranial dura, and I had explained to you about all the meninges. After that, we had drawn a diagram of the spinal cord, and we had discussed lumbar puncture as well. Alright, the clinical anatomy of lumbar puncture. It is done at the level of L3, L4, preferably at the level of L3, L4, or it can also be done at L4, L5. Okay, so go for L3, L4 in your examinations, right? Then modifications of the pia mater, we had discussed 4 modifications. So what were they? Phylum terminale, linea splendens, ligamentum denticulata, right? You remember that we have discussed these modifications of the pia mater yesterday. And the external features, which included the attachments of the various spinal nerves, the external fissures, the sulci, right? All of that we had discussed yesterday. And today we are about to discuss the internal structure. So first we will discuss the basics of the internal structure, and then we will come to talking about the various tracts of the spinal cord. So let's start talking about the internal structure. Now, whenever you talk about nerve tissue, you have this understanding that in nerve tissue, there is going to be gray matter and there is going to be white matter. You all know there is going to be gray matter and white matter. So now tell me, inside the brain and the spinal cord, so inside the CNS, what happens? You tell me. Inside the brain, the gray matter, it is inside or outside? Is it inside or outside? The gray matter, is it inside or outside? The gray matter is present outside and the white matter is present inside. Okay. But when it comes to the spinal cord, it's actually opposite. The gray matter, it is present in the center, and the white matter, it is present on the periphery. So brain and spinal cord, they are opposite in this respect. Let me repeat what I just said. Okay, let's talk about the brain. This is the brain, right? So if this is the outermost region, okay, this is going to be gray matter. This is going to be the gray matter. Okay, Ben 10 का एक character होता था, याद है? Gray matter used to be a character in Ben 10, right? So this part is going to be gray matter, and inside you are going to have white matter, right? Then there is some deep gray matter at the base also. Okay, so basically the gray matter is outside and white matter is inside. That is what we say for the brain. But when we talk about the spinal cord, it is actually not that way. The spinal cord, you all know how it is organized. So in the center you have gray matter, and on the outside you have white matter. On the outside you have white matter. Is that first concept clear to you? Gray matter is surrounded by white matter. So gray matter, it is formed of neurons including the cell bodies, right? Whereas white matter, you have axons which are myelinated. In the white matter you have myelination of axons. So the gray matter, it is present as a butterfly or H-shaped. Okay, so gray matter of the spinal cord, it is present as tell me very quickly, it is present as H-shaped or butterfly shaped. Okay, it is H-shaped or butterfly shaped in nature. Okay, so kaise, what do I mean by that? Let's try to quickly draw the spinal cord. Let's try to draw the spinal cord. Okay, and then we will understand a few things related to that. Okay, so let's take a spinal section of the spinal cord. Okay, so how do you draw the spinal cord? That is very important to know. How to draw an anatomically correct diagram. So in an anatomically correct diagram, please understand that you will always draw the anterior and the posterior. First you will draw that, okay, what has to be the anterior in any diagram. You first draw the orientation of the diagram. Okay, anterior kya hoga or posterior kya hoga. Then remember my words. In the spinal cord, anteriorly, what do you have? Anteriorly you have a fissure. Anteriorly you have a fissure. This is the anterior median fissure. Anteriorly you have a fissure, and posteriorly what do you have? Posteriorly you have a sulcus. Posteriorly you have a sulcus. So please remember, the gray matter that is present, that is present in a H shape or a butterfly shape in the center. Now how is that butterfly formed? Please remember, it does not touch this anterior median fissure. Okay, this butterfly, it does not touch this anterior median fissure. It is present like this. Okay, understand this H-shaped gray matter that is present. Okay, and what do you have posteriorly? You have the posterior median sulcus, and that is actually touching the gray matter. Very important to know, the anterior median fissure, there is some space here. For the white matter to cross. Please remember, please leave this space for the white matter to cross. But posteriorly here, the posterior median sulcus, it is directly attached to the gray matter. First point to be noted in your mind. Very important when you are talking about the structure. Okay. Then in the cross section, the gray matter, you can see that there are three horns. Okay, in some regions you will have 2 horns, in some regions you have 3 horns. So one is a ventral horn. What I've drawn in front, this is called as the ventral horn. Right, this is the ventral horn. Behind what I've drawn, this is the dorsal horn. Right, this region is called as the central gray. And this sometimes, this horn, this may or may not be present, that is called as the lateral horn. Okay, it is only present in the thoracolumbar vertebrae where you have a sympathetic outflow or a parasympathetic outflow, right? It is only present when you have a autonomic nervous system. Only in those spinal segments where you have a autonomic outflow. Alright, so 3-dimensionally, if you look at it, there is an anterior gray column. Okay, if you expand the ventral horns, okay, 3-dimensionally, if you make a column, there is an anterior gray column, there is a posterior gray column, and in between them you have a commissure that is called as the gray commissure. Right, and in the autonomic nervous system, in the thoracolumbar part, you will also have a lateral gray column. Okay, so white matter, it is divided into right and left halves. In the front you have the anterior median fissure from where it is connected, and behind you have the posterior median septum, right, which is a sulcus. Understood? Now, the white matter, like I told you that the gray matter, it forms the horn. The white matter, it forms the, what is called as the funiculus, right? So anteriorly and posteriorly, you have different funiculi. So posteriorly, you will have the posterior funiculus or the posterior white column. So this region on both sides, you have two posterior white columns. So this is called as posterior funiculus, right? On either side of the septum, you have left posterior funiculus and right posterior funiculus. Similarly, you have anterior funiculus. So this is, let's say, the, if this is the left side, so this is the left anterior funiculus. So you will write that there are, the funiculus is a column of gray matter. It is a column of, sorry, it's a column of white matter. So please understand the structural arrangement so far. What is funiculus? What is what are the columns? So anterior funiculus and posterior funiculus. So the white matter between the anterior gray column and the anterior middle fissure, it is called as anterior funiculus. So both the anterior funiculus of both sides, they communicate with each other, right? They communicate with each other. Okay, and on the sides, what is the funiculus going to be called as? Lateral funiculus. All right, that is present between these two gray matter. So this region is, let's say, called as having the, this white matter is called as the lateral funiculus. So sometimes we keep this together and we call it the anterolateral funiculus. If you keep the anterior funiculus and the lateral funiculus together, you will call it the anterolateral funiculus. Okay, so anterior to the gray commissure, the white matter is continuous, and that is called as the anterior white commissure. All right, so this region is actually very important. This is called as anterior white commissure. Anterior white commissure. What is a commissure? Commissure means a fiber that is connecting, white matter fibers that are connecting two halves, right? So there are three types of fibers: projection fibers, transverse fibers, commissural fibers, right? So this is anterior white commissure because it has commissural fibers. So please remember, anterior white commissure connects the two anterior funiculi. So that is the basic internal structure, and this diagram you all should know. You all should know. All right. Now, after this comes the concept of the varying shape of the internal structure at different levels. I will leave that because that is not important from your exam point of view. That is not asked very frequently. Okay, you can read it from your Vishram Singh. So it will tell you that at different levels, the shape of the transverse section of the spinal cord is different, right? Right? In the cervical region, it is oval, right? It is round in the thoracic region. It is again round to oval in the lumbar region, and it becomes round in the sacral region. Okay? So all of this is variable at the various levels of the spinal cord, and that depends on how much tissue is being supplied in that region. Okay? That is why cervical and lumbar enlargements, they have a lot of gray matter. The cervical and the lumbar enlargements, they have a lot of gray matter. Okay? And the white matter, it increases from the lower part to the upper part. Okay? Do you understand this? Do you understand why? Okay, so I can ask you a question. It's a very simple question. In the spinal cord, at what level will you have more gray matter? At what level will you have more gray matter? So your answer should be at the cervical enlargement and the lumbar enlargement. So in the previous lecture, I discussed about the cervical and the lumbar enlargements, where you have the brachial and the lumbar plexuses. So that is the place where you have the maximum number of neurons. So that is where you have cervical and lumbar enlargements. Where will you have more white matter? Please try to understand. Where will you have more white matter? Please try to understand that if this is your spinal cord, right? This is cervical, this is thoracic, this is sacral and lumbar. Sorry, lumbar and sacral. Ulta likh diya. Hai na? So here, let's say you have the arms, and here, let's say you have the legs of the person, and here, let's say you have the body of the person. So what would happen is, all the fibers were coming first. Let's say this is the fiber going to the leg, right? Let's say this is the fiber going to the thorax, and let's say this is the fiber going to the arm. Okay, so more fibers are added as you go above. Okay, the leg fiber is here, so here you have only one fiber. Here you have more fibers. Here you have the maximum fibers. So white matter increases as you go upward in the spinal cord. As you go upward in the spinal cord, the white matter increases as you go upward in the spinal cord. You can understand why. It's very simple to understand, nothing difficult. Okay, now comes the important concept that a lot of people have trouble in remembering. That is also because it's slightly futile, right? That is the nuclei in the gray matter. So what are the nuclei in the gray matter that you have to remember? That is the concept of the Rext nuclei. Okay, so first of all, what is nuclei? A collection of neurons inside the CNS. So inside the spinal gray matter, right? Inside this gray matter, if you have any collection of neurons, that will be called as nuclei. That will be called as nuclei. So in the nuclei, they are present in cell layers, right? So there are almost 10 cell layers. There are almost 10 cell layers that are present in the gray matter, right? And they are called as Rext laminae, right? They are called as Rext laminae. So let's come to this concept of nuclei and Rext laminae. Okay, it's a very interesting concept, but unfortunately it's made very difficult by textbooks because they expect you to remember a lot of stuff. They expect you to remember a lot of stuff. So it's very simple. So there are certain nuclei in the dorsal horn, there are nuclei in the ventral horn, and there are nuclei in the lateral gray, right? There are going to be nuclei in all of these three columns. Agree or not agree? There are going to be nuclei in all of these three columns. So let me just, quickly put up a diagram here. Okay, let me put up a diagram. Just give me 1 second, guys. I'll put up a diagram. Right. So this is the diagram that I wanted to put in front of you guys. Okay. Now very quickly for you guys to understand that this diagram is oriented slightly in a different manner. So what I'll do is I'll rotate it for you guys. Right. Now it becomes simpler for you to understand. Okay. So first of all, tell me which is the ventral horn and which is the dorsal horn. So this is the ventral horn. Remember, it is slightly broader. And this is the dorsal horn. This is the dorsal horn. Okay. So these are the Rext laminae and these are the nuclei. Okay. So these nuclei and laminae, they are correlated to each other. So first understand what are the nuclei and then understand the laminae. Okay. So that you guys are able to read. I will again invert this picture for you, but I just wanted to, compare it with this picture. Just compare it with this picture. Keep it in your mind and then just try to understand that I have just simply rotated it in such a way that the dorsal part is on the upper side. Okay. Some of you might find it slightly difficult to digest, but I think you should be able to do that. Okay. So please understand, on the left, I have been shown laminae. These are called as Rext laminae. Rext means that there is a certain orientation. They are arranged parallel to each other. And then there are nuclei here. So first of all, let's understand that there are nuclei in the dorsal horn. So in the dorsal horn, the nuclei that you have, they are going to be sensory. They're going to be sensory. In the lateral gray column, you are going to have the ones that are supplying the visceral organs. They are related to the autonomic nervous system. And in the anterior gray column, you have the somatic efferents, you have proprioceptive fibers, right? So here you have a medial group, you have a central group, and you have a lateral group. Okay, so let me talk about each of these nerve groups and nuclei, right? Let's start about talking about these very quickly. I'll not spend a lot of time here. Okay, I'll not spend too much time here. So first let's talk about substantia gelatinosa. Okay, substantia gelatinosa. So substantia gelatinosa corresponds to Rext lamina number 2. Okay, Rext lamina number 1 is the posterior-marginal nucleus. Please forget about that for right now. Okay, so I was telling you here that what all do you have to remember first of all. Okay, first the substantia gelatinosa, it corresponds to Rext lamina number 2. It corresponds to Rext lamina number 2. So I'll just mention it here for you. So just compare here. This is Rext lamina number 2, and corresponding to it, you have the nucleus called as substantia gelatinosa. Okay, so I'm highlighting it in red, so I'll, it's very clear for you that this is number 2. Rex lamina number 2 is substantia gelatinosa. It is present throughout the spinal cord. Okay, so please understand what are Rex laminae, what are the nuclei in the gray column. I repeat that throughout the gray matter there is an organization of the various neurons. Okay, in which place what kind of neurons are going to be present. So in Rex lamina number 2, that is in this location, in the dorsal horn, this is the dorsal horn, remember ऊपर को dorsal horn है अभी, right? So in the dorsal horn you are going to have substantia gelatinosa throughout the length of the spinal cord. Substantia gelatinosa has mainly neurons that are related to pain and sensory input, of course. ठीक है? Then Rex lamina number 3 and 4, Rex lamina number 3 and 4, they have nucleus proprius. They have something called as the nucleus proprius. So you can make out here that this is Rex lamina 3 and 4. The nucleus that is related to them is called as nucleus proprius. And as it already tells you that it has the word proprius, so it is related to proprioception. It is of course related to proprioception. Is it related to proprioception? No. It is related to the ventral and lateral spinothalamic tracts. Nucleus proprius, it is related to the ventral and lateral spinothalamic tracts. I will tell you later on what are they responsible for. Okay? Then when you go to Rex lamina number 7, there are a lot of nuclei there, but one of the important ones in Rex lamina 7 is the Clark's column, right? Rex lamina number 7. Okay, this is the Rex lamina number 7. So I will just write it here on the side. Okay, this is called as Clark's column, Clark's dorsal column. Please write it, Clark's dorsal column. Okay, which has been mentioned here as the dorsal nucleus. It is also called as the posterior thoracic nucleus or the column of Clark. So it is also important for you guys to remember. The 7th one, right? Apart from that, it's okay if you remember something, it's okay if you don't remember something. Okay? For example, this 10th lamina is called as the central gray. I've already told you about the central gray. This is called as the central gray around the central canal, right? The ninth one, it contains motor neurons, alpha and gamma motor neurons. Okay? So that is the various nerve groups. Okay, then inside this you will have in the central group certain neurons. For example, you have the nuclei for the spinal axis 3 from the C1 to C5. Then you have the phrenic nucleus from C3 to C5. Okay, these are some things. In the spinal cord, you also have the nucleus of 11th cranial nerve, that is accessory, from C1 to C5, and nucleus of the phrenic nerve will be present in the central column when you talk about C3 to C5, right? That is the central group, that is called as the central group. ठीक है, बस ये root levels याद रख लो इसमें. Understood? बस इतना याद है तो आगे चल सकते हैं. If you know this much, we can move ahead. Now let's talk about tracts. Let's talk about tracts. Everything is clear till here, guys? I have explained the concepts of internal structure of the spinal cord. You all have understood the internal structure of the spinal cord. Any doubts in here? Now let's begin our discussion about the tracts of the spinal cord. Let's begin our discussion about tracts of the spinal cord. Are you all ready? Okay. So I told you the tracts in the spinal cord, they are of two types. You have ascending tracts. You have ascending tracts and you have descending tracts. So ascending tracts, they are going to convey the information from the receptors to the central nervous system, that is the brain. The descending tracts, they are going to bring the information from the brain and they are going to convey it to the peripheral receptors. They're going to convey it to the peripheral receptors. So let's start talking about ascending tracts. First, we will talk about ascending tracts. Okay. So first thing about ascending tracts, they are basically functional pathways and they will take the sensory information from the periphery to the brain. Okay. And all of these tracts that I show you, they will generally have 3 neurons. Okay. First order neurons, second order neuron and third order neuron. Okay. What is the meaning of first order, second order and third order? We will always try to understand that. Okay. And the first order neuron, it is always present in the spinal ganglion. Okay. They're going to cross over before reaching their final destination, and they also give rise to certain collateral branches of spinal reflexes. Okay. Please understand what I've just said. Okay. This is the brain. All right. From the brain down here, I have a spinal cord. Coming from the spinal cord is a spinal nerve, right? And at the end of that spinal nerve, I have a receptor. Okay. So when I want a stimulus, right, what happens is that receptor is going to bring it. And here, remember, you have a dorsal root ganglion for sensory neurons because they are pseudo-unipolar. So that information first goes to the spinal ganglion, right? And then it goes and it is going to get conveyed to the spinal cord. Now from the spinal cord, you are going to have a second order neuron that starts, that is going to go above, and almost always it goes and it synapses in the thalamus. From the thalamus, that information goes to the cortex. So now you understand that there is a first order neuron, which means the first neuron in the sequence, second order neuron, that is the second level of neurons, and third order neuron. So 1, 2, 3, first order neuron, second order neuron, third order neuron. And for ascending tracts, since they are sensory neurons, the first order neuron always have their cell bodies in the dorsal root ganglion or the spinal ganglion. Is that understood? That concept should be clear in your mind. Then we will proceed. Okay. The other concept is that, let's say this is from the left half of the body and this is your brain. So your brain, you all know it has a left and a right. So most of this information from the left side, it has to cross to the right side and then it will be conveyed to the right side. Okay. So it almost always crosses over to the other side before reaching the brain. This is called as decussation. This crossing over is called as decussation. So these two concepts should be clear about decussation and first order, second order, third order neuron. Then we can proceed ahead. Is that clear? Where will the first order neurons be? They will always be in the spinal ganglion. That means that they're going to be there in the dorsal root ganglion. They will cross over, that is, they will decussate before reaching the sensory cortex. They will give rise to certain collaterals for spinal reflexes. Okay? With that understanding in mind, let's quickly begin. ठीक है? किसी को कोई डाउट तो नहीं है? Now, please understand that ascending tracts, they will convey certain sensory modalities. So what are the various sensations? So one sensation that you all know about is proprioception. Okay, that is related to joint position and the movement and the posture, right? One sensation is called as the exteroception, the perception of stimulus from outside. For example, touch, pressure, vibration, pain, itching, tickling, and all of that. Then there is the interoception, sensations that are coming from inside the body, from the internal body, like hunger, thirst, right? The urge to defecate, libido, right? All of that are interoception. So there is interoception, exteroception, and proprioception. These are the three things that can be there, right? So ascending tracts, they can bring proprioception, they can bring extroception. Okay, they're not related per se to interoception, but they can of course be related to fullness of the bladder or the urge to defecate or libido. Some stimuli can also be from there. Okay. There is also certain proprioception that is unconscious. Here I am talking about conscious proprioception. The unconscious proprioception, it goes to the cerebellum. Okay. The unconscious input all goes to the cerebellum. It does not come to the cortex. And there you have only two orders of neurons. There you do not have three neurons. If it has to go to the cerebellum, it will have only two order of neurons. It does not need three order of neurons. Okay. Shall we start? Okay, so first of all, we will start with posterior columns. First of all, we will start with posterior columns. They are the most easy to understand. Okay, posterior columns, they are the most easy to understand. So again, we will draw a diagram of our spinal cord. Very beloved diagram of our spinal cord. We will draw again. First of all, I'll just write here that we are going to talk now about the posterior columns, right? Or the dorsal column, very famously called as the dorsal column. Okay, and this dorsal column, it actually goes into a pathway in the brain called as the medial lemniscus, right? What is lemniscus? I'll come to that, but right now please write it that this is the dorsal column medial lemniscus pathway. It is called as the dorsal column medial lemniscus pathway, right? Now what happens is in the posterior column or the dorsal column, please understand that if this is the spinal cord, let's say I'm making the spinal cord, right? And remember that whenever I make the spinal cord, I make it a point. Let's keep a separate diagram for the ascending tracts now. I'll not draw it here, I'll draw it here. Okay, so let's take this diagram. Let's take this diagram for our understanding, है ना, ताकि मेरे को बार बार ना बनाना पड़े, and you also have get a very beautiful diagram. So here you can understand that, okay, which is the anterior. So wherever you see a fissure, right, you see a fissure here, is that anterior or is this anterior? Tell me, is this anterior or is this anterior? Can you tell me which is anterior? Okay, I'll label it separately, है ना, ताकि आप लोग बता पाओ. Okay, now you tell me that is A anterior or is B anterior? Which of them is anterior? Which of them is anterior, A or B? Come on, tell me quickly in the chat, which is anterior, A or B? Very quickly, which is anterior, A or B? Which is anterior, A or B? Of course, B is anterior, guys, because of the presence of this anterior commissure. Because of the presence of this anterior commissure. Okay, please don't get confused that this is the sulcus or this is the fissure, because the diagram, it's not drawn in that way. It's meant to show you in a different way, right? So please don't get confused because of that. There can be certain times where that is confusing. The septum and the fissure concept might get confusing for you. Okay, so always judge based on 2-3 things combined, है ना, दोनों चीजें आपको देखनी पड़ेंगी, right? Which is going to give you the better result. Okay, so sometimes they might not draw it in the way that you want it. Okay, so let's draw our own hand drawn diagram. That's the best. ना, सेंटर में हमने बनाया डीप सा फिशर, राइट? Then we went like this. Okay, उसके बाद यहाँ सेंटर में ग्रे मैटर आएगा, right? And then you will have the dorsal horn, lateral horn, and let's say this broad ventral horn. Similarly, you have a broad ventral horn here, you have a lateral horn, and you have a thin dorsal. Now, please try to understand what I told you as the posterior funiculus. What I told you as the posterior funiculus. In fact, what you can do is this dorsal horn. Generally, what a lot of people do is they actually, because from the dorsal horn here you have the sensory roots going, right? So they connect this dorsal horn like this. So now what this helps you understand is that there is this region that is the posterior funiculus, and here you have posterior gray matter. Here you have posterior gray matter, right? And this is what is called as the posterior column. So if I'm shading this here in yellow, that is actually called as the dorsal column. Now you understand why it is called as the dorsal column. You understand why it is called a column, because it is present throughout the spinal cord. Why is it called as dorsal column? Because it is present in the posterior region of the spinal cord. Like I told you, this is anterior, this is posterior or dorsal, right? And this is medial and lateral, or left and right. Okay. So this is the posterior region. So this is the posterior column. In the posterior column, you have so this is all the fibers here, they will form the dorsal column pathway. Now dorsal column pathway, it is responsible for proprioception. P for posterior column, P for proprioception. Now how I remember it is that you will remember the differences. You will remember the differences between the dorsal column and the anterolateral column. Okay, in such a way that the dorsal column, it is actually both of these are tracts, but the dorsal column is a highway. The dorsal column, it is a highway, and the anterolateral column, it is a village road. Okay. Now how this helps you remember is that the dorsal column, it is a much more advanced pathway. It came later in evolution, so it will carry more advanced senses. Okay, what are the advanced senses? For example, proprioception, right? Then vibration, fine touch, okay, and also 2-point discrimination. Okay. Now you will say that is touch carried by dorsal column? Okay, so there are two types of touch: crude touch and fine touch. Fine touch is by dorsal column, crude touch is by anterolateral column. Okay, so here you will have primitive senses, lots of them: pain, now all of these are carried by the anterolateral column. All of these sensations, they are carried by the anterolateral column. ठीक है, अभी एंटेरोलैटरल कॉलम के बारे में अलग से बात करूंगा. आई जस्ट वांटेड टू हेल्प यू रिमेंबर कि डॉर्सल कॉलम में क्या क्या है, राइट? बिकॉज इट इज अ हाईवे, दीज रोड्स आर मच बेटर, सो दे आर better myelinated, so they have faster speed of conduction. Okay, because they are highways, so the cars will move faster on them. Village roads, they are in a poor condition, they have poor myelination. Okay, and correspondingly they are also slower. So that's the difference between the dorsal column and the anterolateral column. Is that clear to you? Is that clear to you all? The dorsal column versus the anterolateral column. Now let's talk about the posterior column or the dorsal column medial lemniscus pathway. So it carries fine touch, vibration, and remember, conscious proprioception, not unconscious proprioception, that is carried to the cerebellum. So for the sake of repetition, and conscious proprioception. Very important. The word conscious is very important. Conscious proprioception, right? That goes to through the dorsal column path. Okay. So where does it receive input from? So it receives its input from the Pacinian corpuscle, which is responsible for vibration, the joint receptors, the muscle spindles, and Golgi tendon organs, right? And there is a somatotropic organization in the posterior column. What does that mean? That I'll tell you what is the somatotropic organization. Okay. So in this posterior column, please understand that it is divided into two. It is divided into two. Okay. Right. On the inside, please write gracile fasciculus. Please write gracile fasciculus. So posterior column, it is divided into gracile and cuneate fasciculus. Okay. It is divided into gracile it's better if I write it, outside. So there is a gracile fasciculus and there is a cuneate fasciculus. Okay, so gracile fasciculus will go to the gracile nucleus, cuneate fasciculus will go to the cuneate nucleus, right? So there are two fasciculi, gracile and cuneate. So gracile one is medial and cuneate one is more lateral. Okay, what does that mean? Okay, so have you heard about so the meaning of somatotropic organization is that the sensation for various regions of the body, it is arranged in a specific pattern in the spinal cord. All right, so gracile refers to sensations coming from the leg. Okay, so sensations from the leg, they are going to be present most medially. The sensations from the leg, they are going to be present more medially, whereas the sensations coming from the arm and the upper torso, they are going to be present more laterally. Okay, so this is the somatotopic organization. And how do you remember this? See, gracile or gracile, gracious, right? Kya gracious hota hai? So please remember that the girls of that leg were very graceful. Sorry, the legs of that girl were very graceful. Okay, so you can remember the legs of that girl were very graceful, right? So gracile fasciculus is related to leg, right? And in Hindi there is a thing called as koni, right? So you can remember that us इंसान ने मुझे कोनी मारी. So cuneate related to the arm, right? So cuneate is related to the arm, gracile is related to the leg, and that is the somatotopic organization in the posterior column. Okay, so let's start and let's understand that how it is going to go. How is the posterior column lemniscus pathway going to go? Okay, so shall we draw the dorsal column lemniscus pathway for you guys? Okay, I guess I'll have to draw, है ना? Okay, or what we can do is we can take a beautiful image. Okay, so please try to understand what is happening. Please try to understand what is happening. So first of all, which is the receptor here? Which is the receptor here? You have to understand. These peripheral processes, they are coming from somewhere. They're coming from somewhere. Enough. And what are those sources of input? What are those sources of input? Right, we can probably draw that. Right, so that input is basically coming from a few receptors, right? They can include muscle spindle. They will include the Golgi tendon organ, right? For vibration, you have the Pacinian and the Ruffini's corpuscle. So I will write Pacinian corpuscle. That is going to be there in the inputs, right? You can have some input from the Meissner's corpuscle. And then there are certain receptors that are there in the joint and in the soft tissue. So joint receptors I'm writing. All of these are going to form the input, right? All of these are going to give the stimulus. All of these are going to give the stimulus. Now this stimulus that happens, it is the first order neuron, the peripheral process, right? Remember the first order neuron, it is going to go and it is going to have its nerve body or the cell body in the dorsal root ganglion, right? That is also called as the spinal ganglion. So this fiber, it goes, right? The central process is here in the dorsal root ganglion, and then it goes to the spinal cord. And after 1 or 2 levels, it is going to synapse in the spinal cord. It is going to synapse in the spinal cord. Is it going to synapse in the spinal cord right now? First order neuron ban chuka hai, right? First order neuron ban chuka hai. So after some time, it is going to descend. It is going to descend, and of course, the synapse will have to occur at a nucleus. Okay. So in the lower extremity, it forms the gracile fasciculus, and as you keep going above, more fibers are added to it on the lateral side. And as you come to the upper extremity, another separate fasciculus is formed called as the fasciculus cuneatus. Okay, so these axons, they are going to ascend throughout the column, and they are not crossed yet. They have not crossed yet. They are uncrossed fibers. They are going on the same side. Please note that these fibers that have begun on this side, okay, they are going on the same side. Okay, they are going on the same side. I'll trace the pathway once more for you. Don't worry. They're going on the same side, and as they go, so you can see them going above. So this is the gracile fasciculus on the medial side, and more lateral to it, you have the cuneate fasciculus. So the gracile fasciculus, it goes and it synapses in the gracile nucleus. So here you have a collection of neurons that is actually the second order neurons, and here you will have a synapse where this neuron, it will actually go and it will synapse with the nucleus in the gracile nucleus. It will synapse with the cell body or the dendrites in the gracile nucleus. From there you will have the second order neuron, and before the formation of the second order neuron, you will have the sensory decussation. This is called as sensory decussation. Okay, so you see here that after this synapse in the gracile fasciculus, these second order neurons, they are going to give rise to axons, and these axons, they are going to cross to the other side, and together they will form a bundle that is called as the medial lemniscus. It will form the medial lemniscus, right? So please understand, here you have this crossing. Okay, from right the fibers are going to the left, from left fibers are going to the right, and this is called as, these axons here, they form the internal arcuate fibers. This crossing here, when they are crossing, they are called as the internal arcuate fibers. While they are crossing, they are called as the internal arcuate fibers, right? Then they are going to go upwards and they are going to form a lemniscus. So this is together called as the lemniscus. So on the left side, this will be called as the left medial lemniscus. So this is called as the medial lemniscus. That is why you see it was the dorsal column which after crossing over has become the medial lemniscus, right? And then it is going to go upwards and synapse in the thalamus, right? Which nucleus of the thalamus? So it synapses in the ventero-posterolateral nucleus of the thalamus, VPL of the thalamus. From the thalamus, you have so it reaches the thalamus VPL, and from there it goes to the post-central gyrus, which is the somatosensory cortex called as area 312. Okay, the post-central gyrus right? Called as area 312, which is the somatosensory cortex, and it reaches that via the posterior limb of the internal capsule, via the posterior limb of the internal capsule. Okay, do you guys want me to draw this? Do you guys want me to draw this, or have you understood on the basis of this particular diagram? If you understood everything, let me show you one more diagram. Okay, and in this, although both are shown, we will see only one at the moment. Okay, right now we are only interested in this much of the picture. Okay, so what is happening here? You can see the multiple levels at which this is happening. Okay, so at what all levels is this happening? Let's start from the very beginning. Okay, so first of all, you had a, let's say you had a Paxinian corpuscle. Let's say you start with a Paxinian corpuscle, which was bringing the sense of vibration, right? That Paxinian corpuscle, it comes into the dorsal root ganglion. That Paxinian corpuscle, it comes into the dorsal root ganglion. That Paxinian corpuscle comes into the dorsal root ganglion. Here you have the first order neurons, right? These first order neurons, they have a central process that goes upwards as the posterior column. Then it reaches the cuneate nucleus, which is at the level of the medulla. Then from here, there is formation of internal arcuate fibers and the sensory decussation. And from the level of the midbrain, you have the medial lemniscus, right? From here, you call it the medial lemniscus. It goes upwards into the ventero-posterolateral nucleus of the thalamus, from where it goes to the somatosensory cortex area 312 of the post-central gyrus in the brain through the posterior limb of the internal capsule. So I will label some structures, just label them along with me. All right. So here you had the first order neuron coming from the receptor. This was called as the, let's say, the gracile fasciculus. Let's say this was coming from the leg. So it will be called as the gracile fasciculus, right? The second order neuron, it will be forming in the nucleus gracilis, right? Or the gracile nucleus. Then you have the formation of the crossing over fibers, that is the internal arcuate fibers at the sensory decussation in the medulla. Internal arcuate fibers where they are going to cross over to the other side, right? So they started from the left, you went to the right, and now you are forming the right medial lemniscus. This is called as the medial lemniscus. These are second order neurons that are going to end up in the ventero-posterolateral nucleus of the thalamus, VPL of thalamus. From the ventero-posterolateral nucleus of the thalamus, from thalamus, the fibers, they reach the cortex through the internal capsule, right? So they are in the present in the posterior limb, right? Internal capsule, it has posterior limb, anterior limb, right? I'll talk about internal capsule separately, but for now, please remember posterior limb of internal capsule. And ultimately, all the sensory input goes to the somatosensory cortex, which is present in the post-central gyrus, okay, which is called as Brodmann's area 312. Okay, Brodmann's area 312. That is the pathway that is being followed by the dorsal column or the posterior column. Okay, this pathway is often asked to you. ये pathway आपको draw करना आता है exam. Okay, that is why I am stressing on it so much. I hope you have noted this down. Noted? Shall we move ahead? Let's go to the anterolateral system. Let's go to the anterolateral system. Very quickly, let's move to the anterolateral system. Any doubts so far? Any doubts so far? All the labelings are clear. Everything is clear. I've made many labelings. Okay. So next, let's proceed to anterolateral column. Let's start talking about the anterolateral column first. Okay, so again, we will go back to our first diagram. We will again go back to our first diagram. So in the anterolateral system, it is basically present in the place that is सबसे आगे. Okay, anterolateral system. You can basically draw it somewhere here. Okay, it is present like this. This is the anterolateral tracts. Okay, so anterolateral tract में again medially you are going to, so outside you are going to have legs and inside you are going to have arms. इसमें थोड़ा ऊट पटांगे है ना, leg यहाँ पे, arm यहाँ पे, right? So please label this as, again I'll draw it in yellow because it is an ascending tract. So if this was the dorsal column, please label it. This was the dorsal. This is the anterolateral column. Okay, let's talk about it. So now this is talking about the anterolateral system in which you have two parts. One is the anterior and one is the lateral. That is why it is called as the anterolateral. So when you talk about the anterolateral tracts, there are two parts. One is called as the anterior. One is called as the anterior spinothalamic tract. Okay. One is called as the anterior spinothalamic tract and the other is called as the lateral spinothalamic tract. The other is called as the lateral spinothalamic tract. The other is called as the lateral spinothalamic tract. Right? One is called as the anterior spinothalamic tract. The other is called as the lateral spinothalamic tract. Okay. So the anterior spinothalamic tract, it is concerned with touch. It is concerned with touch. So touch means crude touch. Of course, it means crude touch because anterolateral column, it does not carry fine touch. It carries crude touch. And the lateral spinothalamic tract, it is related to all the other things. Pain, temperature, right? So mainly, please write here pain and write here temperature. They are carried by the lateral spinothalamic tract. Now, why are these tracts called as spinothalamic? So because they are going from the spinal cord to the thalamus. Okay, that is actually representing the second order neuron that is going from the spinal cord to the thalamus. That is why they are called as spinothalamic tracts. You will see a lot of tracts that are named based on their origin and destination. For example, if I say spinocerebellar tracts, so that means that they are going from the spinal cord to the cerebellum. If I say spinorubral tracts, so the word rubral refers to red. That means that they are going to the red nucleus, right? I'll talk about the red nucleus later, but just for now, I'm telling you that when you say spinothalamic tract, it means that it is going from the spinal cord to the thalamus in the VPL. Okay, that is the ventero-posterolateral nucleus, right? So let's start. How does it happen? So please remember that the anterior spinothalamic tract, it is responsible for crude touch. So the input will come from Merkel disc. The input will come from Merkel disc. Remember in physiology, I've taught you about Merkel disc, Meissner corpuscle, Paxinian corpuscle, all of that, right? It can also come from free nerve endings, but prefer to write Merkel disc, right? Input of lateral spinothalamic tract, it will come from free nerve endings, right? Free nerve endings. And it will also come from thermoreceptors, right? There are lots of thermoreceptors. We've talked about thermoreceptors in detail, right? The thermoreceptors. So the input will be through the pain fibers, you all know, are A gamma and C fibers, fast pain and slow pain. And you have a somatotopic organization with the cervical fibers are present anterolaterally and the sacral fibers, they are posterolaterally. है ना, मैंने arm और leg की position आपको समझाई. Okay. So what about the first order neurons? They are going to be found in the spinal ganglion, right? They are going to be found in the spinal ganglion. ठीक है? चले आगे बात करें. चले आगे. तो डायग्राम के बारे में थोड़ी बात कर लेते हैं. डायग्राम के बारे में थोड़ी बात कर लेते हैं. करें कि ना करें? Now please remember here what happens. There is an anterior spinothalamic tract and there is a lateral spinothalamic tract. So when you talk about these tracts, let's try to trace their pathway just like we had done for this particular diagram. है ना? इसमें हम उल्टी साइड ले लेंगे डायग्राम की. इसको क्रॉप कर देते हैं. Okay, so in this case what happens is let's say there was a receptor here. Let's say there's a free nerve ending. From there the neuron starts. The cell body is in the spinal ganglion, that is the dorsal root ganglion, right? From there it enters the spinal cord from the posterior side, and here there is a posterior tract called as the dorsal tract of Lisor, right? एक tract होता है यहाँ पे which is a intermediate tract, right? It is not a proper tract. Okay, छोटा सा जरा सा send करता है ऊपर नीचे. That is called as the posterolateral tract of Lisor. Okay, so I'll write here that posterolateral tract of Lissaur, right? Lissaur. So basically what is happening is that, for example, this neuron, it was going to the level of this was the spinal segment L1. Okay, now from L1, let's say the second order neuron, it is present in T12, or it is present in T11, or it is present in L2. So the posterolateral tract of Lisor, it will allow that axon to go slightly above or slightly below, one level above or one level below. That is the role of posterolateral tract of Lisor. Okay, nothing much. So you can absolutely skip it out of your mind when you are thinking, but just remember that ऐसा कुछ होता है. Okay, so I'm just giving it a label so that you guys don't forget. Right? From here in the posterior horn, you have the second order neuron that starts. Now the beauty of the second order neuron is that from the anterior white commissure, it crosses over to the other side. From the anterior white commissure, it crosses over to the other side. So when I make this labeling here regarding the posterolateral tract of Lisor, it means that the descent has not, the crossing over has not taken place. Okay, but then these fibers, they cross from the anterior white commissure to the other side, and then they contralaterally ascend as the lateral spinothalamic tract. They go to the ventroposterior lateral nucleus of the thalamus, and then finally through the posterior limb of the internal capsule, they will reach the somatosensory cortex. Again, the same things to be noted. Just very quickly, I will note them for you. Decussation. It occurs in the anterior white commissure. Remember, in the spinal cord, we had left some place in between the gray matter and the anterior horn, right? So in this place, this is where the crossing over is taking place, right? Like this, the crossing over takes place. So this is the place where I was telling you that there is some communication. Okay, so this is the decussation in the anterior white commissure. Then it ascends as the lateral spinothalamic tract. It goes to the medulla, it goes to the midbrain, and finally synapses in the ventero-posterolateral nucleus of the thalamus. Okay, it has already undergone crossing over, so it does not cross over in the sensory decussation, right? And then via the posterior limb of the internal capsule, you reach Brodmann's area 312, that is your somatosensory cortex in the postcentral gyrus. Somatosensory cortex in the postcentral gyrus. Is that clear to each and every one of you? Is that clear to each and every one of you regarding the first order, second order, third order neurons for the anterior spinothalamic tract? Almost the same thing, and lateral spinothalamic tract. Okay? So they are going to synapse with the second order neurons. They are going to decussate in the anterior white commissure, and they are going to ascend. ठीक है? Now there are two more ascending tracts to be aware of. There are two more ascending tracts to be aware of. Right? One is called as the anterior spinocerebellar and the other is called as the posterior spinocerebellar. Okay? So please mention anterior and posterior. These are spinocerebellar. So now will you be able to draw all the ascending tracts in one diagram? Is it simple to draw? Based on the position, it is very, very simple to draw on one side all the ascending tracts. Will you all be able to draw? चलो बताओ, चलें आगे. Shall we proceed ahead? Anterior and posterior spinocerebellar tracts. Can we talk about this? Okay, relatively less important when it comes to writing your answers and everything, but we have to be fully aware. So first let's write about posterior spinocerebellar. So now it automatically tells you that okay, since this is spinocerebellar, it is going to go to the cerebellum, and cerebellum receives all the unconscious processing, especially related to balance, so related to proprioception. So all the unconscious proprioception is going to be carried through the posterior spinocerebellar tract. Remember, the conscious proprioception, it was going through the dorsal column or the posterior column, but the unconscious proprioception, it is going to go through the posterior spinocerebellar tract. Right? Where will the input be coming from? It will be coming from the muscle spindles, the Golgi tendon organs, the pressure receptors, right? That is the same input, right? Input is the same: muscle, spindle, Golgi tendon, organs, joint, receptors, all of that. And it is important for fine coordination, all the fine coordination that has to be done, right? That is why when you say that, you know, person is alcoholic, so function of cerebellum is lost. In that case, that fine coordination cannot be done for posture and for movement of the lower limb. Okay? The important thing is that tracts of the cerebrum, they are crossed, but the tracts of the cerebellum, they are uncrossed. They are not decussating. Tracts of the cerebellum, they are uncrossed. Please make this in bold. Tracts of the cerebellum, they are uncrossed. So please remember, the posterior spinocerebellar tract, it is uncrossed. Okay? So how this happens is, where are the first order neurons? Where are the first order neurons? So first order neurons, okay, they are going to begin from the muscle spindles and the Golgi tendon organs. So they will be found from C8 to S3. They will be found in the C8 to S3 spinal segments in the dorsal root ganglion. They are the first order neurons, right? From there, if I begin from there you have to go to the spinal cord. So in the spinal cord, they will synapse in the posterior lateral column, or the also called as the Clark's column, posterior lateral column, or the Clark's column. Okay, so they will synapse in the Clark's column. So Clark's column is related to proprioception. It is related to proprioception. Alright, so they are going to go to the Clark's column. First order neuron is going to synapse there. Now, second order neurons, they are found here in this posterior thoracic nucleus from the spinal level C8 to L3. Sorry, did I write S3? C8 to L3. Please make a correction, C8 to L3. Right? So this Clark's column, remember, this was Rex lamina. 7 was Clark's column. Remember Rex lamina we studied initially. So there you had studied about Clark's column. Now, in the second order neurons, they will give rise to axons that are going to ascend in the posterior spinocerebellar tract, which is present in the lateral funiculus, that is the lateral region of the white matter, right? And it is going to reach the cerebellum. Okay, so it is going to ascend in the posterior spinocerebellar tract, right? And after that, it is going to reach the inferior cerebellar peduncle. So through the inferior cerebellar peduncle, it is going to enter the cerebellum. Okay, so there are 3 peduncles: superior, middle, and inferior. So it is going to enter through the inferior cerebellar peduncle. It is going to enter through the inferior cerebellar peduncle, and they will go to the vermis, right? It will go to the vermis as mossy fibers. Okay, so ipsilaterally it continues as mossy fibers to the rostral and caudal of the part of the cerebellar vermis. Okay, there it will form the cerebellar circuitry. Understood? First thing. So just like the posterior spinocerebellar tract, there is also an anterior spinocerebellar tract. ठीक है? Posterior की जगह इसको कर दो anterior. Anterior spinocerebellar. It also transmits unconscious proprioception. Okay, and it is related to the coordination of lower extremity. Again related to lower extremity. But the anterior spinocerebellar tract, it is the crossed tract. Okay, even though it is a tract of the cerebellum, it is crossed. Okay, so anterior and posterior, a very big difference. The anterior spinocerebellar tract, it is going to cross. Okay, since it is only related to the lower extremity, it is found from L1 to S2. It is found from L1 to S2. L1 to S2, right? The synapse is on the spinal border cells. They are not the Clark's column. So please write it goes to the spinal border cells, that is the second order neurons. Spinal border cells. Spinal border cells. They are found in the anterior horns of L1 to S2. They are found in the anterior horns of L1 to S2. Okay. So they will give rise to axons that are going to decussate. There is going to be crossing over, cross in the anterior white commissure. So the crossing over will occur in the anterior white commissure. Okay. And then they are going to ascend in the anterior spinocerebellar tract, which is lateral to the lateral spinothalamic tract. They are going to ascend. ऊपर जाएंगे. ठीक है. Then these axons will enter the cerebellum via the superior cerebellar peduncle contralaterally. ठीक है, इस बात को समझो. They will terminate via the superior cerebellar peduncle. ठीक है, so please write here. So now please try to understand the beauty of this system. Please try to understand beauty of the system. Remember I told you that for cortex everything is contralateral and for cerebellum everything is ipsilateral. Now you must be wondering, यार दूसरे example में तो ये violate हो गया. In the second example I said that the first order neurons, they are going to reach the posterior, they are going to reach the spinal border cells, and then they are going to cross, and then they are going to cross. Okay, but that is the beauty. Okay, when they cross, they are going to not go through the inferior cerebellar peduncle, but they go to the superior cerebellar peduncle of the opposite side, and then they go as the mossy fibers to the rostral vermis. Okay, please try to understand how this is happening. Just let's make it more clear for you in another diagram. We'll take a diagram in a minute. Before that, let me explain cuneo-cerebellar tract. It is basically the upper extremity equivalent of the posterior spinocerebellar tract, right? Let me just write it down for clarity. Cuneo-cerebellar tract, it is the upper extremity equivalent. Okay, the above two tracts we described so far, they were mainly for the lower extremity. So this is the upper extremity equivalent of the posterior spinocerebellar tract, right? First order neurons, they are found in the spinal segment C2 to T7, right? These first order neurons, they will project their axons. The axons will go via the cuneate fasciculus to the medulla, right? Through the cuneate fasciculus. Okay, so tract is slightly different. They will go via the cuneate fasciculus to the medulla. So inside the medulla, you have the accessory cuneate nucleus. Okay, the accessory cuneate nucleus, which is the equivalent of Clark's column, accessory cuneate nucleus. So here you have the second order neurons, and they will give rise to the second order neurons that will go via inferior cerebellar peduncle to the ipsilateral caudal vermis. They will go to the ipsilateral cerebellum. Please keep this tract in mind. Now it's time to understand the beauty of the spinocerebellar tracts. It's time to understand the beauty of the spinocerebellar tracts. समझे एक बार? Are you all ready so far? Okay, so the beauty of the anterior spinocerebellar tract is that even though it crosses here, you can see it is crossing over in the anterior wide commissure. Okay, so it started from the Golgi tendon organ, it crossed over here, it ascended upwards, but when it goes to the superior cerebellar peduncle, it again goes to the other side. So it has crossed once, it has crossed twice. So घूम फिर के मुसाफिर घर को आ गया, right? So it comes to the same side. So what I told you for the cerebellum is true. That left side of the body goes to the left side of the cerebellum. Okay? So you might say, how are the tracts cross? Because they cross a second time in the superior cerebellar peduncle. So that is a very interesting concept to understand, that the crossing is occurring actually twice. Okay, it is going to the contralateral side twice. So this is for the anterior spinocerebellar tract. Similarly, you can draw diagrams where you are showing the posterior spinocerebellar tract. Okay, and that you will show the nucleus dorsalis or the column of Clark, right? All of that you can show in a diagram as per your need, as per your, whatever is asked in the question to you. And, you can draw a diagram accordingly. This is what I wanted to show you guys. Is this clear to all of you? Okay, so you'll find some very good representations in book for this. Okay, this sort of a diagram you will find where it is shown that the posterior spinocerebellar tract, it goes like this through the inferior cerebellar peduncle, and the anterior spinocerebellar tract, it goes like this. Right? Then you might find diagrams in which the cuneo-cerebellar tract is also shown with the accessory cuneate nucleus in the medulla. So whichever diagram you find, please use it. Please use it to develop your understanding. Right, so here you can see the accessory cuneate nucleus of the cuneo-cerebellar pathway. So use these diagrams to supplement your understanding. Rest everything I have written for you guys. So that brings us to an end of the various ascending tracts. That brings us to an end on the various ascending tracts. Okay. So I think it's almost 1.5 hours. We'll cover descending tracts in a separate session, I think, because if this session, it'll get too stretched. Okay, so see, these were the sensory or the ascending pathways or the sensory tracts, right? So please understand that I've explained to you the dorsal column medial lemniscus system, which had the gracile fasciculus and the cuneate fasciculus. That is very visible here beautifully in the posterior funiculus, right? On the lateral side, you had spinocerebellar tracts, which included posterior and anterior spinocerebellar tracts. Along with that, you have a lateral spinothalamic system and a anterior spinothalamic system. Along with that, there are certain fibers that are called as spino-olivary fibers. I have not discussed them, but when I draw a table of all the afferents, I will discuss them separately. Okay, but all the major ones, I have completely discussed the ascending tracts. Okay, so this is one of the most comprehensive videos you will find related to the ascending tracts. In the next video, we will cover descending tracts because I don't want to make this session too lengthy by including descending tracts here. That will take another half an hour of explanation. Okay, so we will do descending tracts in the next lecture. And that will sum up our spinal cord. I don't want to rush through tracts because tracts is your basic. अगर मैंने तुमको सिर्फ ट्रैक समझा दिए ना तो तुम्हें ब्रेन स्टेम वगैरह सब धीरे धीरे समझ आने लगेगा. अगर तुमने ये जो pathways that I'm drawing, if you're able to understand these, you will understand each and everything very slowly. Okay, there will be no lag in your understanding. So go through this lecture once. It's a difficult lecture. It's a difficult understanding to build for a lot of people. So if you are able to do this, well and good. Okay, so today we studied the internal structure of the spinal cord. Okay, we studied the nuclei and the rex lamina. We studied the ascending tracts. In the ascending tracts, I told you how to draw the diagram. I told you about the dorsal column medial lemniscus pathway. Then I told you about the difference between the dorsal and the anterolateral column. Then we discussed the anterior spinothalamic and the lateral spinothalamic tracts. Along with that, we discussed the cerebellar ascending tracts, including the posterior spinocerebellar, the anterior spinocerebellar, and the cuneo-cerebellar tracts, right? And that ends up our explanation of ascending tracts. In the next session, we will discuss the motor or the descending efferent pathways. Okay, and in a separate session, the blood supply also. Is everything clear so far? Please give me a yes or no. Is everything clear so far? Have you guys understood? I'm giving you 2-3 minutes to clear your doubts, to review whatever we have gone through, and if there are any doubts that you have, you guys can ask them right now and we will try to clear those. Okay, and then we will end the session. So I'm here for you for another 2-3 minutes. If you have any doubts, you guys can let me know. If you have any doubts, you guys can let me know. Any doubts? Any of you? Any doubts? Let me just quickly go through everything once more for you all. The internal structure, the nuclei and the rex laminae, the ascending tracts, this diagram to draw. Okay, the dorsal column medial lemniscus pathway, the dorsal column and the anterolateral columns, including the anterior spinothalamic tract and the lateral spinothalamic tracts, the cerebellar tracts, including the posterior spinocerebellar, the anterior spinocerebellar, and the cuneo-cerebellar. Followed it up with the cross section. So I hope that makes everything clear. If you had any doubts, you guys would have asked them. So thank you so much guys for watching. If you liked this video, if you understood everything, I hope you did. Please remember to hit the like button and drop a comment as to if you liked the video, and do share it with all your friends. Ask them to study neuroanatomy from this very YouTube channel, that is Unacademy Future Doctors. And you also please remember to subscribe to this YouTube channel. I will be very shortly sending the PDF for you all to download. And please remember to hit the bell icon for notifications. Thank you so much guys for watching. In the next session, we will be covering descending tracts, and also we will be covering blood supply of the spinal cord. All right. So see you guys in the next session. Thank you so much, guys, for watching. All right. Take care, guys. Bye bye. Thank you so much. I'll be ending the stream now. If there are any doubts, we can also take them up in the next session. Thank you all. Please remember to hit the like button on this.